Mental health problems are very prevalent in our society. They are the second biggest cause of disability across the world. Common human afflictions like depression, chronic anxiety, substance abuse really affect the lives of our patients.
The challenge we all face is that mental health is oftentimes a lifelong condition that requires a lot of effort. It requires a change in lifestyle. It requires therapy. It requires the hard work and the struggle of facing our demons. And we appreciate that at UC San Diego Health.
People feel like they're alone, having these thoughts and having these feelings that no one's going to be able to understand or relate to, or that they're going to be able to get any help with. But I can assure you that there's a lot of help out there, and there's a lot of treatments that will be available to help people with these feelings and these thoughts and these symptoms to improve and get better.
UC San Diego Health is really committed to personalized care. That means taking the best research evidence, combining it with the unique circumstances of each person, and then bringing in a compassionate, comprehensive healthcare system to really help the person get well again.
We bring the science and the scientists to the clinic, to the bedside, to provide evidence-based treatments.
We could use techniques like virtual reality to assist in the treatment of people with post-traumatic stress disorder. We are not simply applying things that other people have found. We are developing the future for our patients.
15% of women experience some sort of mood or anxiety disorder in pregnancy, and up to 20% in the postpartum period. However, a lot of moms just don't understand when they are having symptoms. A lot of new moms think it's normal.
When we had our fourth daughter, it was extremely stressful, and it was a result of, I believe, a lot of changes in our life. And I became much more worried, much more anxious. I would become extremely suspicious that something bad was going to happen.
A lot of people come in feeling very overwhelmed or having really guilty thoughts. Some people even have really scary, intrusive thoughts. There's a certain point where it's affecting or impairing a mom's ability to take care of herself and take care of her child.
I had gotten to see Dr. Reminick after about 5 months of dealing with these symptoms. She immediately recognized them, and I remember that first sense of relief that we were on the right path finally to getting better, because I at least had a diagnosis. She wasn't just concerned about me, she was concerned about my family as well, which I felt was crucial in me getting better.
We really form a relationship and a bond here in this clinic that I don't think patients experience anywhere else.
They specialized in meeting my needs and getting me back on track to health, giving me the peace of mind that even if recovery is far off, that it's still possible.
There are powerful alterations of the brain that are contributing to why people have eating disorders. These are disorders that affect all people, all ethnicities, and we treat whoever needs help.
I've tried like every sport under the sun: volleyball, lacrosse, gymnastics, cheerleading, soccer. So once I stopped playing sports and I was getting older, I gained more weight. It just wasn't normal for me. By any means, I wasn't overweight ever, but it was an unnatural feeling for me since I had been so active my whole life. I would eat the same things, but I would eat less and less and less and less until I was eating like almost nothing.
And it just all seemed really reasonable until overnight it was not. It was terrifying.
Even though I know now it was anorexic, I had no clue what was going on. They're really focused on including all of your support that you may have, friends, family, whoever that may be.
We often find that we can treat people with eating disorders that might otherwise need a residential or inpatient program because we have a wide variety of staff here. Psychologists that are skilled in therapies. We have psychiatrists that are skilled in medication and medical care. And we have dietitians in our kitchen.
When I first started recovering, I thought that I could recover, but I never thought that I would enjoy food again. Standing here now, I never thought I would be here when I was 17. I didn't want to enjoy food ever again. So now I traveled Asia. Eating all the new food was the part I was most excited for.
We'll be at a restaurant or we'll be cooking when you're like, oh my gosh, I can't believe we're just like normal people who never had any, an eating disorder in our family.
We at UC San Diego Health have the best clinicians and researchers that can focus on your specific problem. We think we are in the best position to help people, particularly those suffering from more complicated conditions, to heal themselves.